Hey there, guys. John Hawes, RN, founder of nursing.com. And today I just wanted to talk to you about how you can succeed in nursing school with dyslexia. And to do that, I'm just going to kind of read this post to you that we recently made and sharing one of the success stories of one of our users who does have dyslexia and ADHD. First of all, I want you guys to know that you're not alone. In fact, 8% of the users at nursing.com have dyslexia with countless success stories. So, what is dyslexia? Well, it's really a trouble with reading despite normal intelligence. So these are intelligent people who are having struggles reading, specifically spelling words, reading quickly, writing words, sounding out words in their head, and pronouncing words. So, why is nursing school then so difficult for these people? Well, to me, it's really clear why it's so difficult. Schools love to measure how well students can read and write, and those who can read and write well are called bright, intelligent, quick learners. And from an early age, rather than receiving accommodations, many students who struggle with reading and writing and have dyslexia are labeled as lazy or stupid. And many educators and society in general misunderstand and or do not diagnose these students, leaving them to struggle, just sitting in the classroom feeling dumb. Now, the problem is, unfortunately, nursing school is overflowing with excessive reading. There's so much to learn, and overwhelmingly, that learning is done through assigned readings. In fact, it would take an average reader about 41 hours every single week, reading every single week, to complete a med-surg book in a semester. Now, that's true. I did the math. This is me flipping through one of my old med-surg books. It's 1,853 pages. So you can imagine this is an unachievable task for someone with dyslexia. But I think the world needs more dyslexic nurses, and I'm serious about that. Dyslexia impacts up to 10 to 20% of the population, yet society is drastically behind helping those who struggle. And sadly, only about 3 to 8% of nurses report having dyslexia. So while we have 10 to 20% of society who has dyslexia, only 3 to 8% of nurses. We need to do a better job getting these individuals, these amazing individuals, into the profession. I believe that empathy gained from having this learning difference and from clawing your way through an education system and reaching RN, that empathy is something that you can apply to all the patients you take care of who feel lost. This is your superpower. So let's talk about how to succeed in nursing school. The first thing I want to say, guys, is it's so important that you have a diagnosis, that you can go to your college, the Student Success Center, and make sure that you get accommodations put in place and that you take full advantage of these accommodations. The reason I stress this so much is only about 24% of students with dyslexia ever disclose to their college that they have this issue, and so they don't get accommodations. These accommodations can make tremendous difference in your experience and in the outcome. So also make sure you use things like text-to-speech, audiobooks, study with a friend who can take notes, allow extra time, draw diagrams, and set yourself a schedule and stick to it. Now I want you guys to watch this success story. This is Ellie, who has ADHD and dyslexia, but recently passed the NCLEX and is a practicing nurse. Some of the things she mentions that helped her was realize that you have to find what works for you. It's going to be different than what works for other people. Read assignments and charts out loud, check and recheck assignments, take medication if you have something like ADHD as well, or anxiety. Have a study buddy who can help you with notes. Watch the videos on nursing.com, review the cheat sheets, and draw pictures where it helps. Guys, at nursing.com, we believe very strongly in learner equity. We believe that every student should have access to learn the way that they learn, especially if they have a learning difference. At nursing.com, we give you the meat and the potatoes, short videos to help you learn and understand what you're doing. So trust the videos at nursing.com. You might not even need your textbook anymore. This is a common thing we hear from students. Take your professor's notes and look on nursing.com for videos that match up with that. Watch the videos, download the notes and cheat sheets, and take the associated quizzes. I know you guys can do this. You can succeed. Go out and be your best self. Happy nursing.